Well, when I got here, I really didn't know where to go or what to do. I felt alone, and I just felt a lot of despair. Couldn't figure out what I was going to do because I was going through these continuous stages. And that's when I had actually thought about suicide as a way out.
Originally from Colorado, Michael moved to Phoenix suffering alcoholism.
And as you can see, this is more or less a place for people like me where we used to camp, and some still do.
Painful memories hunt him.
I've been homeless for 8 years, off and on. I really didn't deal with what was the problem that I had, and that was the grief that I had with my brother, his death. He died of brain cancer 10 years ago, and my family suffered with me for 2 years, and then I left them so they could be away from me.
Sadly, Michael's story is not uncommon. There are many people suffering along out on the streets who think there is no hope and nowhere to go.
CPLC offers hope through a pathway of recovery leading to self-sufficiency and empowerment. We are committed to providing integrated health services to individuals from infants through the elderly.
CPLC impacts more than 200,000 individuals in the southwestern United States each year through programs in 4 pillars of service: housing, economic development, education, and integrated health and human services.
When I first met David Adame and his executive team, I couldn't have been more pleased to have the opportunity to work with such a prestigious not-for-profit organization that really understands that giving someone a helping hand up and not a helping hand out is really the way that we can all improve the communities in which we live. It really aligns with our mission of helping people live healthier lives. And for the past 2 years, we've been working to make that dream a reality, and we're very excited to have our first center up in Maryville.
Unique solutions through innovative partnerships such as the national pilot program My Community Connect and CPLC Insurance are simply the natural outcome of pioneering organizations who understand the importance of evolving to meet the complex needs of a community that's changing.
We're able to work with an organization such as CPLC to integrate more fully the social services with medical, behavioral, and dental services in a trusted way. We are very excited to be partnering with Chicanos por la Causa in a new model that looks at all of the individuals within our communities and serves them in a way that addresses all of their needs. Whether they're a United member or someone else's member, we want to lift up our communities and rise people out of poverty.
One of the great opportunities Blue Cross and Blue Shield has had to work with CPLC is in the implementation of the Affordable Care Act. CPLC became a broker for coverages, and as a result, more Arizonans now have health insurance coverage than ever before.
The future belongs not to traditionalists who are rigid, but to those organizations that can leverage resources to fully meet the changing needs of a community in transit.
CPLC is a fixture in the community. They're focused not only on their employee well-being, but the well-being of all of the members of the community. Being able to partner with CPLC has allowed us not only the ability to develop a relationship and to work with CPLC and their employees, but also to develop our partnership in the community as well.
I'm pleased to say that my relationship with CPLC is about 20 years in length, and over that time I've been able to meet some terrific CEOs of the organization, including Pete Garcia, Edmundo Hidalgo, and now David Adame. I think that the thing that impresses me most about the organization is how it's continually changing to meet the needs of the community.
I spent 8 years here in this area. Off and on, I tried different rehab facilities, 4 to speak of that were within the last 2 years. And I didn't find the type of resolution or help that I needed until I got to Corazon. There I found people there that actually cared about me, And they were more of a family there. They treated us as we were part of that family as well.
Corazon is an example of a successful men's residential substance abuse treatment program and crisis step-down facility. CPLC also offers in Arizona behavioral health services, serious mental illness clinic, domestic violence abuse program, HIV prevention, outreach and education services, children's safety and intervention program in Nevada, and home health services in New Mexico.
I'm real excited for all the opportunities that lie ahead of me. I'm just ecstatic about my future, and I'm hoping and praying for the brotherhood of the guys that are at Corazon as we move on to another level of performance in our lives. It's been a wonderful blessing that I was able to take part with Corazon, and I thank God that I was part of it.